Hey guys, Dr. Owens here. I get a lot of questions at our office at Owens Dental about dental implants. It's very common. Almost every day we're getting questions. So my goal today is to put some of those questions to rest and hopefully answer some that you might have. So a dental implant is a tooth replacement, right? It's basically a small titanium screw that goes in to replace the root of a tooth, right? So it's going to give you a new tooth where you lost one. So dental implants are really common because they're so effective and they're very predictable. We like them for replacement of most teeth. I get the better question would be, why would we not recommend them? Because we recommend them very, very frequently, especially when you're missing teeth and on either side of the space, they're really good, nice teeth that we don't want to drill on or do any work on like that. So there are also cases where we need them to help hold in dentures. People who can't tolerate dentures very well and they need help holding those in dentures are an awesome substitute for that. So the advantages are, like I just said, you don't have to touch or mess with the other teeth as you do when you do a bridge or something like that. So it's very effective for replacing a tooth. The other advantages are they're really a lifetime type restoration. That's not 100% of the cases, but in most cases, they're going to be there the rest of your life. They don't get decay because they're not made out of tooth structure. They're made out of titanium. They're also very pretty. Looks just like a natural tooth. You can eat on them, chew, brush, floss, everything like you do a natural tooth. If you're already missing the tooth, then we'll evaluate that area, make sure that it is a good candidate for an implant. We'll also evaluate your medical history and things like that. If it is, then we'll go ahead and move forward with placing the implant. After we place the implant needs to heal for a while. It needs to do what we call osteointegrate. That's a fancy word. Osteo means bone, and integrate means to become one with. So it's got to become one with your bone, and that can take about 12 weeks or 3 months or so. After that, we'll fit it for a brand new tooth or a crown. We'll put that on there, and then you have your new tooth. The other possibility is that you need it for some dentures, right? Same type procedure, except instead of fitting it for a crown, we're going to fit it and attach it to your denture or to a new denture. Well, there's some things in a medical history that can cause us to not feel like implants are the best option. One would be, if you're taking a bisphosphonate, which is a drug that many women take for osteoporosis. Some cases you wouldn't be a good candidate for an implant. There's other things that would put you at risk for implant failure where we want to be a little bit more careful, such as smoking or diabetes. So all these are, we want to look at your medications and see what is the best course for you. It's a case-by-case basis. First, we need to review your medical history. Then we need to find out what is it that you want and what is it you're desiring and what do you want to get out of your treatment. Once we do that and we can kind of figure out what you're looking for and what would best suit you, we can put together a plan that fits both what your wishes are and also what you need and want economically. In other words, what you want to pay for, how much things cost and stuff like that. So like I said before, the first step is we're going to place the implant, right? That's a lot of people are nervous about that. That's actually a very simple procedure to do. Doesn't take very long, maybe 30 minutes, where we actually place the implant and close it up so that it's underneath the gums. You don't even know that the implant's there. A lot of people ask me, well, how much does that hurt? It doesn't hurt. It's actually less than a tooth extraction. So it's not very much, but we do give you medications and things to help with that. Later on, we'll fit you for a crown just like we would a normal tooth. And that's it. Then you have your implant. Sometimes bone grafting is required after we remove the tooth. So if we remove a tooth, there's a nice size hole there where the tooth used to be, and this is called the socket, right? So many times we want to do what we call a socket preservation, which means we don't want the socket to close in and that hole to go away. We want it to stay a nice thick bone right there. So sometimes we'll put in some graft material, which in most cases is like a synthetic collagen, which means synthetic means it's not taken from another human, to promote your own bone growth. There are cases where we have to do more extensive bone grafting. It's not very common, but that's the cases where the sinus cavity has invaded and doesn't allow us to do an implant or the bone has become too thin. That's kind of something we have to evaluate at your appointment. There's a lot of different choices, ranging anywhere from something removable, like a denture or a partial, all the way to kind of what our favorite is implants, right? You have to kind of decide what fits your budget as well as what fits your needs and what fits what you can have medically. So those are all the things that we decide when we sit down with you. We like dental implants because it's most like a natural tooth. There's in-between options too, such as a dental bridge. That's something that doesn't come in and out. We use the teeth, the natural teeth that are still there to replace teeth. Those work very well also. And they're kind of a good in-between option between something removable and something permanent. So those are things that we need to evaluate and talk about at your appointment, but those are your various options. It depends on the case, depends on your medical history and how many implants we're doing. But if we're just doing one single implant on a relatively healthy person, it doesn't take very long, maybe a couple days, 2 to 3 days, and you're back to normal. We ask you not to chew on that implant for about 2 to 3 weeks, though, because that's a very important time in the implant's life. But as far as pain and getting back to normal, it's usually just a couple days. Dental implants are meant to last a lifetime. They're meant to be there your whole life. It is helpful that they don't get decay, so you're not going to get cavities on them, right? You still need to brush them and take care of them and like you would a natural tooth, but they're meant to be there for the rest of your life. Yeah, so that can really vary depending on what we're doing the implant for. Are we doing it for dentures? Are we doing it for a single tooth replacement? Are we doing it for a multi-tooth replacement? So there's a lot of variables that go into that, and it also depends on your dental insurance plan. Most dental insurance plans these days do cover it, but that's something that we would need to check at your appointment. The cost can vary if you have no insurance from in the $2,000 range all the way to where insurance covers a large portion of it. So it's very case dependent. What we want you to do is give our office a call. You can find us on the website. Get our number, give us a call, come in, sit down with us, let us take a look and see what's going on, find out a little bit about you, find out a little bit about what you're looking for. That way we can make the best recommendation for you. So you can also reach us by email or on social media, but the best way is just give us a call. We're very friendly. We'd like to sit down with you, take some time, take a look, get to know you, and let you know what your options are. Thanks a lot.